Hello everyone, and a very warm welcome to the channel. If you're a senior or you have a loved one who is, I want you to listen closely. Did you know that in the last year alone, over 60,000 seniors missed out on crucial Medicare updates, potentially costing them dearly? 60,000. That's a stadium full of people who might not have the best coverage simply because the system can be so confusing. I'm here today to make sure you're not one of them. We're going to walk through this together step by step, so you can feel confident and secure about your healthcare future. Let's talk about something really important coming up in 2026, changes to the Medicare enrollment periods. Now, I know what you might be thinking. More rules, more dates to remember? And you're right, it can feel overwhelming. But think of it this way. These changes are designed to give you more flexibility and better options. The key is understanding them before you need them. For years, we've had the same familiar windows to sign up for Medicare. But the healthcare landscape is always changing and Medicare is adapting with it. For 2026, the government is introducing new special enrollment periods, or SEPs. These are special windows of time, outside of the usual annual enrollment, that allow you to make changes to your coverage due to specific life events. So, what are these new opportunities? Let's break down the most significant one first. Starting in 2026, there will be a new special enrollment period for individuals who lose their existing health coverage. This might sound familiar, but the rules are getting a much-needed update. In the past, if you lost employer-sponsored coverage, you had a limited window to act. The new rule aims to provide a more forgiving and straightforward process. Imagine you've been working past 65 and enjoying your company's health plan. You decide to retire in March. Under the new 2026 guidelines, you will have a clear, designated period to enroll in Medicare Part B without facing a late enrollment penalty. This is a huge relief, removing a major source of stress for many retirees. It ensures a seamless transition from your work insurance to Medicare, so you're never left with a gap in coverage. Let's hear from someone who has navigated this system. I recently spoke with a gentleman named Robert, a retired teacher. He shared, "When I retired a few years ago, the paperwork was a nightmare. I was so worried I'd miss a deadline and be penalized for the rest of my life. My friend, who retired a year after me, actually did miss his window and is paying a higher premium every single month. Knowing that there will be clearer rules in 2026 for people like me, it's just a massive weight off your shoulders. It lets you focus on your retirement, not on red tape." Robert's story is a powerful reminder of why understanding these changes is so vital. It's not just about saving money, it's about peace of mind. The penalty for late enrollment in Part B is permanent. It's added to your monthly premium for as long as you have Medicare. By being aware of these new enrollment periods, you are protecting your financial well-being for decades to come. Another key update for 2026 involves exceptional circumstances. The definition of exceptional circumstances is being expanded to cover more situations. Have you ever been affected by a natural disaster, like a hurricane or a wildfire that prevented you from managing your affairs? Or perhaps a sudden, serious medical issue in your family took all your time and attention? In the past, getting an extension for enrollment in these situations could be difficult. Starting in 2026, Medicare will have more clearly defined guidelines for granting special enrollment periods in these types of emergencies. If you're living in an area declared a federal or state disaster zone, you will likely automatically qualify for an SEP. This means you will have extra time to review your plan options and make changes without worrying about missing a deadline while you're focused on getting your life back on track. This is a compassionate and common sense change. It acknowledges that life happens, and when it does, you shouldn't be penalized for it. Think about it. During a crisis, the last thing you should be concerned about is Medicare paperwork. I spoke with a financial advisor who specializes in retirement planning, and she put it perfectly. She said, "These changes reflect a deeper understanding of the real-world challenges seniors face. It's a shift from a rigid, one-size-fits-all system to one that has a bit more heart." My advice to clients is always to know their rights. Knowing you can request an SEP during a family emergency is a right you need to be aware of. This isn't just about disasters either. The expansion could also cover situations where you received misleading information from an employer or even an insurance agent. If you were incorrectly told you didn't need to sign up for Part B, for example, the new rules for 2026 will provide a clearer pathway to correct that mistake without a penalty. This puts more power back in your hands and holds the system accountable for providing accurate information. So how can you prepare for these 2026 changes now? The first step is what you're doing right now, getting informed. Knowledge is your most powerful tool. Start by making a note on your calendar for late 2025. Set a reminder to check the official Medicare website, Medicare.gov, for the finalized details. The information we're discussing today is based on the announced plans, but the specific language and procedures will be published there first. Second, if you're planning to retire in or around 2026, have a conversation with your HR department well in advance. Ask them specifically about how your company health plan coordinates with Medicare and what their offboarding process looks like. Don't just assume they'll give you all the information you need. Be proactive. Ask questions like, what documents will I receive upon retirement to prove I had creditable coverage? And what is the exact date my coverage ends? Having this information in writing can be incredibly helpful if you need to apply for one of these new special enrollment periods. Third, let's talk about the annual enrollment period, which happens every fall from October 15th to December 7th. Even though we're focusing on 2026, this annual window is still your most important opportunity to review your coverage. Don't just let your plan auto-renew. Your health needs can change, and the plans themselves change every single year. Their costs, their networks of doctors, and the drugs they cover. Use this time each year to do a full checkup on your coverage. The changes in 2026 are a safety net, but proactive management during the annual enrollment period is your best offense. It's about creating a habit. Just like you schedule an annual physical with your doctor, you should schedule an annual Medicare review for yourself. Sit down, look at your current plan, consider your health needs for the coming year, and compare it with the new options available. Are your doctors still in-network? Are your prescriptions still covered at a price you can afford? Answering these questions every year is the single best thing you can do for your health and your wallet. Navigating Medicare can feel like learning a new language, but you don't have to do it alone. There are free, unbiased resources available to help you. Every state has a State Health Insurance Assistance Program, or SHIP. These programs are federally funded and staffed by trained counselors who can provide one-on-one help with your Medicare questions at no cost to you. They don't sell insurance. Their only job is to help you understand your options. We'll put a link to the National SHIP Locator in the description below this video. Please use this resource. It's there for you. As we look toward 2026, the key takeaway is this: Medicare is evolving to be more responsive to your life events. The introduction of more flexible and compassionate special enrollment periods is a positive step forward. It means that if life throws you a curveball, whether it's retirement, a natural disaster, or a family emergency, you have a safety net. But this safety net only works if you know it's there. The responsibility is on us as a community to share this information. Talk to your friends at the community center, mention it to your neighbor, and please share this video with your family members. Every senior deserves to navigate their retirement years with dignity, security, and the peace of mind that comes from having the right healthcare coverage. Thank you so much for spending this time with me today. I know it's a lot of information, but breaking it down makes it manageable. My goal is to empower you, to replace confusion with confidence. If you found this video helpful, please give it a thumbs up and consider subscribing to the channel. We'll be releasing more updates and easy-to-understand guides to help you make the most of your Medicare benefits. Stay safe, stay informed, and we'll see you in the next video.